All right, are we live?
Yeah.
Yes. A very good evening, one and all. I'm Vishnu Bharadwaj, and I'm the chair of Council of Reproductive Sexual Health and Gender Education, which we call Courage, from SIMSA. And I'm also the co-founder of Bleed with Pride. And today we present to you finals of a debate on transgender rights. Before I introduce you to this debate competition, how it held, I would like to give a brief profile about the organizations that are hosting this. So this activity is being hosted in a collaboration with SIMSA, Bleed with Pride, and Asian Medical Student Association, EMSA India. So three of us have collaborated to bring this, to create a platform to increase discussion upon transgender rights and transgender health. And on that, we have initially started with an idea to put up a debate competition. So, and when we have opened registrations, we had a very huge number of flowing. So while we opening the registrations itself, we had a question in there. We had a case for everyone to solve. So only those who have solved this case correctly, the top 30 members who have solved this case correctly, have come to the prelims round. And in the prelims, there were 3 judges who were screening them who was screening them, and it went on, and it was an extraordinary and thrilling session for all 3.5 hours. It was a thrilling session for 3.5 hours, and and from that we have selected our 10 top participants. 5 of them will be speaking for the motion, and 5 of them will be speaking against the motion. And by saying this, I would like to welcome our esteemed judges, Dr. Bharat Kumar sir, Samyukta ma'am, and Dr. Sharada ma'am. So I would be introducing each one of them. Dr. Bharat Kumar sir, he is a professor and head of HOD of Forensic Medicine and Toxicology Department at Mamata Medical College, Khammam, Telangana. He is a medical legal consultant and the editor of Research Bulletin, Mamata Medical College, and chairman of Scientific Research Committee. He is also a member of Telangana Academy of Forensic Medicine, IAMF, Competence-Based Medical Education, and MMC Khammam. So we are so honored to have you here. Sir?
Hello. Good evening to one and all. Good evening, madam. Good evening, Vishnu. Good evening, one and all. I'm very pleasure to be a part of this final debate. So definitely it's very useful. And apart from my side, I will definitely actually participate. I will give my final opinion. Thank you.
Thank you, sir. Thank you so much for having you, for joining us today, sir. And Miss Samyukta ma'am. Samyukta ma'am is a first transgender employee of Swiggy, taking up a position of principal program manager. She works with NGOs and placement organizations to help transgender women secure mainstream jobs at corporations. So she herself have gone through a transition and also helps others come into jobs and find better career opportunities. Ma'am, so honored to have you here.
Yeah. Thank you so much, Vishnu. And then, the important point about being part of such a conversation is that the conversation is expanding from just a group of transgender people or LGBT activists to the medical community, which I think is wonderful. And so, thank you so much for the opportunity.
Thank you, ma'am. It's a pleasure to have you here. And next, I introduce Dr. Sharada ma'am. She has done her MBBS from Siddhartha Medical College and has done her post-graduation from CMC Vellore and has 28 years of experience in her field. She's a renowned gynecologist, and ma'am, we are so honored to have you here.
Glad to be here.
Ma'am, we lost your video. Yes, ma'am.
Yeah, glad to be here, Vishnu.
Thank you, ma'am. Thank you so much. So by saying this, with no further delay, we'll be going ahead with the wonderful participants we have today. And Ramya, over to you. Ramya?
Vishnu?
Yes.
Yes, Vishnu. So Ramya will be taking over in a few minutes, but till then I will start.
All right.
Okay.
So you can announce the first contestant and who will be counteracting them.
Yeah, sure. So first we have Ayush Vaibhav. Ayush, you there?
Yes, ma'am. Good evening. I'm Ayush Weber from KMC Bangalore, imperatively supporting my cause and going for the motion.
Yes, Ayush. So Ayush Vaibhav, the contradicting participant for him will be Deependra Singh.
Deependra Singh. Okay.
Yeah,
So Ayush should be contradicted by Deependra Singh. And Ayush, can you please turn on your camera?
Absolutely, sir.
Yes.
So am I visible?
Yes. Perfect. Yeah.
Okay.
All right. Hold on a second. And Bhajan, everything set, right?
Yeah, I think it's right.
All right. So on a count of three, you can start, and I hope Sulekha, you can go ahead with the timer as well.
Yeah, sure.
So okay, before I start the session, I would like to announce the topic for our audience. So I'd like to announce a topic for our audience. A topic for finals is, should compulsory age regulation be imposed on gender affirmative therapy? Those speaking for the motion are going to be arguing that age restriction, there should be a minimum age restriction of 18 years. And those who are against the motion are going to be arguing towards this could be less than 18 years. So that's how today's debate is going to be progressing. We are hoping for some very, very important inputs towards this topic. And by saying that, I'll be flagging off the session. And yeah, Ayush, you can start. The moment you start speaking, Sulekha will start the time.
Okay, sir. I'm going to start now. An estimated 0.7% of children and adolescents under the age of 18 years identify as transgender or gender diverse, with more recent estimates of up to 1.8% of high school students identifying as transgender. Family and guardians play an important part in gender affirmation, including social support and access to medical resources. The involvement of parents and family in the care of transgender youth is considered the standard practice. However, a parent's reaction to a transgender child may not be that of acceptance. This can create conflict not only in the child or teen's home life, but also with decisions around medically assisted gender affirmation. Although social transition and hormonal suppression are considered reversible interventions, gender affirming surgery is permanent. Gender affirming surgery is currently recommended for individuals aged at least 16 years of age, but often greater than 18 years of age. Despite data showing benefits of medical gender affirmation for minors, risks remain. Minors must be informed about the potential for medical gender affirmation to foreclose on future fertility options. Hormone therapy with estrogen or testosterone can prevent spermatogenesis and ovulation respectively. Sperm and oocyte cryopreservation can be costly and includes procedures that can induce emotionally distressing side effects. And currently, there is no definite practice guidelines for fertility preservation for transgender patients as well. Additionally, hormone therapy can complicate surgical therapies for minors who use GnRH analogs as well, followed directly by hormones. The prevention of secondary sex characteristics by hormone therapy may result in requirement of additional tissues using vaginoplasties as well. The infertility due to surgical alterations or hormone therapy should be weighed against the potential benefits of a medical gender affirming treatment in minors. The persistence of a prepubescent body habitus due to puberty suppression has been linked to a decreased social inclusion of transgender youth whose physical development is asynchronous to the cisgender peers. The heterogeneous nature of minors' capacity to understand their medical concerns as well as assent to treatment requires a nuanced approach to each decision-making process. Clinical reality and the current landscape of guidelines defy the possibility of making neat ethical and decision-making guidelines and category distinctions among minors. Ideally, the discussion to initiate gender-affirming treatment would include both parents and minor. A child's participation in the medical decision is making considered a dynamic process based on age and an individual child experiences with and capacity to understand a medical condition. Even in situations where parents wish to withhold gender-affirming care, it is imperative to consider categories of gender-affirming care that could be accessed via minor's consent alone through pre-existing legal carve-outs. For example, a menstrual manipulation could be considered gender-affirming care, but could be accessible to a minor without parental consent, which could offer a much feasible alternative instead of a complete overhaul before the prescribed age. To all my friends and fellows, at our core, we know who we are, and affirming that to the world is our right. All I say is give it some time and thought. Only then will you make a lasting impact. Thank you.
Perfect. So, Vaibhav, you've taken 2 minutes and 48 seconds. So next, do we have Deependra Singh here?
Yes, ma'am.
Yes, Deependra. So can you switch on your video? Yes. Deependra, would you like to start?
Like, okay, like as you said that hormonal therapy can be dangerous, but what if the person is going under the, like, to a therapist, mental health counselor, and as well as taking the hormonal therapy also? Like you said, hormonal therapy are reversible. So like if the person is not, like, not feeling good about himself, he can stop the therapy.
Should I reply to that?
Yeah.
So Deependra, is that it, your contradiction?
And one more thing, he said that it is a medical condition. Like, yeah, it is a disease. So like, it's not a medical condition you can relate to. It is just the feeling what the person has inside him or her.
I'm not sure if I said that it's a medical condition, but okay.
All right. So Vaibhav, just a second. Again. So Sulekha, are we reset and ready with the timer?
Yes, Vishnu.
Yes, Vaibhav, the moment you start speaking, timer goes on.
Okay, I'm going to start replying now. Okay, whereas a core gender identity is typically, concordant with assigned sex based on observed external genitalia, it's not always the case for all the people, With increasing evidence that gender identity lies not in between our legs, in our genitalia and primary sex characteristics, but in our brains and minds. So, going alone to just a practitioner or a psychotherapy session doesn't aid you completely.
Vaibhav, we lost your voice. Hold on the timer.
Hello, sir, am I audible?
But yeah, Vaibhav, I stopped the time. You can again start.
So what is the time before we start again? How much
28
time?
seconds.
Okay.
Okay, I'll start again, sir.
Yes.
Okay.
So from the 28 seconds, I mean, you have 32 seconds for you.
Okay, sure.
Yes.
Okay, so I was just telling that it's imperative to understand one's assigned sex at birth may differ from one's core gender identity. Not because of poor parental handling or infantile confusions or because of, some brain or mind gender messages, etc., which you can go and discuss in a psychological therapy. Overriding signals from the genitalia and chromosomes and parental exception also play a very huge impactful role, which you got to analyze on yourselves. So that is my argument for your first question. And secondly, I don't think I never mentioned that it's a disease. And I think you got that wrong. But yeah, it's a definite treatment. It's a definitive proper agenda that we have to promote for a particular age group, for a particular person to make a proper decision. Thank you.
So judges, Dr. Bharat sir. Sir? Dr. Bharat sir, I guess you're in mute. Yes, sir, would you like to give your comments on the first speaker?
Yeah, well, Ayush, I was given adequately and sensible this thing. Okay, it's fine.
Thank you, sir.
Thank you, sir. Thanks a lot.
Samyukta ma'am, would you like to say something?
Your debate was full of data, but I still did not see the inference. What do you do with that, with the data that you collected? That medically or physically, these are the things. I'm just trying to understand what is the inference and why people there should be that age limit. That I'm not sure that came out clearly. I understand the medical reasons and all that, but being a transgender person, apart from the medical perspective, right, there is this human element to it, whether like what kind of therapy I should or should not get, right? So yes, as I said, medically, a lot of things that you said which made a lot of sense, right? So yeah, good. Thanks for that.
Thank you, ma'am. Thank you so much.
And Sharda ma'am.
Yeah, I really liked your justification, ma'am. It's good.
Thank you, ma'am. Thank you so much.
Yes. So thank you, Ayush. It was a wonderful speech, and it was very electrifying. So by saying that, we'll be going towards our next participant, Sulekya. Would you mind telling us who's next?
Yeah, so next we have Insha Arshad going against the motion. Insha, you're there?
Yes.
Yes, so contradicting Insha, we have Chaitna. So Chaitna, hope you're ready.
Chaitna, if you are ready, please do say yes.
Yes, sir. Yes.
Yes, okay.
Yeah, so we'll just have one voice test. Can you just say something, Insha?
Yes. Am I audible?
Yes, you're clear.
Okay.
All right. So again, yes, the moment you start speaking, as I mentioned, timer goes on. So like,
Sorry, 1 second. Vishnu.
Yes, ma'am.
Every time before the person starts speaking,
yes,
can you mention what the person is going to talk about? Is it either
yes,
for or against? And clearly say what exactly is that? Okay?
Yes, ma'am. So Insha, you will be speaking again as the motion.
Yeah. Okay.
Yes. You're
Yeah.
going to be, so Insha
Sorry,
is
which is what? Against the motion, which is what? What is the statement?
So as I mentioned, ma'am, the topic remains the same. So these
No. Okay. Just making sure, right?
Yes,
I
ma'am.
want you to say that before every participant starts speaking consciously. Don't assume anybody knows what is going on. Okay, just
Yes.
clearly say this person is going to talk against the motion, and their argument is that there needs to be no age limit, or they're
Yes.
okay with transgender care under 18, right?
All right. Yes, ma'am. Sure.
Cool. Yeah.
Right.
Thanks.
So Insha will be speaking towards a flexible transgender, flexible age limit towards the trans people. And again, Insha, the moment you start speaking, timer goes on.
Okay, let's start now. Oh dear God, please make me a girl when I wake up. These are the prayers a child does when he or she, whoever, is going through this inner turmoil. This child is not just mentally going through an emotional disturbance, but he's also being questioned by the society. Who is the society to question them? Nobody. The society makes them feel like they're the circus animal. It isn't some intrinsic visceral epiphany that they have. That they have. It is just that they are different, and it's okay to be different, right? Am I wrong? Is it okay to be different? Yes, it is okay to be different. So why are they questioned? So I believe that a child should be allowed to go through this gender affirmative care before the age of 18, because they will hit puberty before that. They will be going through a lot of hormonal changes and a lot of tests. For example, there's a male born child and he goes through a lot of hormonal changes. This testosterone is already working. It makes the male the heart jaw is already made, the hair is already in the process, everything, the puberty basically hits, and that's where the child is emotionally seen as a different thing, and emotionally he feels different, and he goes to school and he goes through a lot of process. And I feel that the child should have the right to choose before the age of 18, so that he goes through whatever he feels, he becomes the same person. he can have hormone therapy, he can have like the top mate. A lot of people have come up with things saying I don't want to have a flat chest, because after if I do it after 18, it is going to take time. The surgery itself is a lot taking time. So a person goes to college and then he has to miss out college because there is time, it consumes a lot of time. So these are the thing, and that's what this they um, basically people start to feel there is something wrong. Their siblings who are not trans, they are being differentiated, and that's what they basically, the child goes through a different set of memories, and hence
30
her
seconds
his or her personalities becomes different. The child's personality and psychology affects the future of that person in the coming years, and that we don't want it to be affected. The mental health may be affected. Not everybody has the stamina to understand that, like to deal with it, right? A lot of children who might not be able to acknowledge it, like deal with it,
Three
um,
minutes up.
can accept it in their future. So I feel like that's what it is. So I feel like before 18 they should be allowed to go through it. Thank you.
Thank you, Insha. You've taken 3 minutes and 13 seconds. Next, we have Chetna contradicting for Insha. Chetna, are you there?
Yes, ma'am.
Yeah, can you switch on your video?
Uh, Sorry, ma'am, there's some
Oh,
problem.
okay. No issues. When you're ready, we'll start the timer.
Can I start?
Yes, you can start.
Nice speech, Insha. But you said that the hormonal therapy should be done before 18 years because of the hormonal changes and everything. But according to me, for the hormonal therapy to be done, the main indication is they should have the adequate mental capacity, right, to give the informed consent for it to for it to happen. And I think that they're not that capable at that age for them. Before 18, I don't think they're capable. And you told me they need to have enough stamina to accept and everything, but these are long term changes and there are negligible chances of them to regret it and stuff.
Can you
So
come
yeah.
again? Your audio was not visible. What did you just say?
What?
I couldn't hear you. Can you just come again, please?
There will be no negative marking. You can go ahead. You can repeat that statement.
Okay, so yeah, so Insha, you told me that you spoke about hormonal therapy, that it should be done before 18 years and stuff. But according to me, hormonal therapy's main indication is they need to have adequate mental capacity to give a informed consent for them to take this treatment, because at 18 years I don't think they have the mental capacity for them to judge or for them to decide.
Yeah, your
Because
1 minute is up, Chetna.
yes.
Insha, would you like to start justifying yourself?
Yes.
Yes, yeah.
Okay. A child starts to go through his feeling at he recognize his feeling basically by the age of 4 or 5, and till he reaches like his puberty age, we won't say he's mature enough by experience. Maybe he's not mature enough by experience, but he does acknowledge his own identity and his own feelings. So I don't consider that 18, right? Just right, 18 is the right age, because a child is able to choose what he's going to be in future, and everything like his study aspects. We do choose our subjects beforehand, right? So that when a child is mentally strong enough to decide, to feel for himself, to know what he is exactly going through before 18 as well. And that's what makes me feel that 18 should not be like the fixed cemented age that should be. If a child has gone through things and if he's ready for it, we should like push him, and without any hiccups, go for his treatment. Yeah, I hope I justified your
Yes,
point.
Insha, you've taken exactly 1 minute. Thank you.
Thank you.
So that was a wonderful speech, Insha. And yes, opening up towards the judges. Bharat sir.
Yeah, she told right thing, but our as per our law of land and legal issues, if she was the person was underwent before the 18 years for the any hormonal replacement or something else, no. If in future also sometime the person does not like the previous sex or something else, then there is no chances of the reversion, no. And one more thing, consent problem. So these are the two issues supposed to remember. But as per our Indian law and ethical issues, but 18 should be completed. Okay, thank you.
Yes, sir. But for today's debate situation, we've asked our participants to assume they were in a policy-making body. They were in a governing body where they are debating towards bringing out a policy, towards making, decreasing the age limit or against it. So we've asked them to assume that way so they can prepare better, sir.
Yeah. But here the parents should be give consent. No? In our society, the parents does not accept because acceptance is very low in our society. So the parents' consent is required if they are the minors. No.
Yes, sir.
So of course, this point also it is acceptable, but
Yes.
we need one for further to get the conclusion at the end. You know. Okay.
Yes.
Thank you. Thank you.
Thank you so much. So Samyukta ma'am, I'd open to you.
Yeah, Insha, that was a really nice speech. I'm happy you brought in the human aspects of being a transgender person, right? Like what Bharat sir said, yes, the current legal, status is that. But I think what we are trying to argue for or against is, if you want to bring in a change, or if there was no such legal, legal things existing, what would be the best approach to take? If we are open, if all of us are open to the idea of discussing what is possible and what is not, then your arguments make a lot of sense to me. So thank you so much for making this.
Thank you so much, ma'am, for the comments. And now I open for Sharda ma'am's comments.
Isha, I liked how you debates, and I do agree with Bharat sir. Legally, we may need after 18 years only.
So just so we are very clear, Vishnu, I want to bring out this point,
Yes.
right? That the way we are going to do this is we are not going to assume that any legal constraint exists at the moment. What we are going to ask these participants to do is, if you are going to make a law, right? What is the law you're going to make? And what are your arguments that support that, right? So with due respect to both Bharat sir and madam, it does not matter. It does not matter that there is an existing law that says, below 18 you can't. What we are asking the participants is, assume if there is no law, and assume we are going to make a new law. What is the law that you guys are going to support, and what is the argument for supporting that law? And the participants are going to make their arguments for that. And I'm going to assume that we are going to judge how good are they making those arguments for the law that they want to make, right? So let us not pre-conclude that one thing is right or wrong. Thank you.
Yes, ma'am. And I totally agree with what Samyukta ma'am said. And sir, Bharat and Sharda ma'am, I kindly request you to assume for this session that we do not have a law and we are trying to bring out something new here. So just for the sake of this session, I would request you, sir, let us
support to Samyukta madam. Yes, that is true.
Yes, thank you so much, sir. Thank you so much, ma'am.
Okay.
Yes, ma'am. I hope the scoring goes accordingly. Thank you, ma'am. So, yes, Insha, it was a wonderful speech. And thank you so much for joining us today. And yes, Sulekhya?
Yes, next we have Sonali speaking for the motion. That means she will be speaking about, the age restriction should be minimum of 18 years. So contradicting Sonali, we have Amukta. Amukta, are you there?
Yes, I'm there.
Yes. So, Sonali, once you're ready, you can start. The timer will go on.
No, Sonali. Can you repeat once again, please? No, your voice is not clear. Could you try removing the mic, please?
Now,
Yeah, can you try once again? Can you speak once again?
hello.
Yes, this is much more clearer. How about say a sentence, something?
All right. Good evening to one and all present here.
Yes, this is audible. This is audible. So from now, the moment you start speaking, we'll start your timer. All right? Yes, go ahead.
Your sexuality isn't about whom you go to bed with, but rather whom you go to bed as. Love is love. Good evening to everyone present here and my fellow opponents. I'm Sonali, and I strongly believe that compulsory age regulation should be imposed on gender affirmative therapy. Why after 18? Because, all right, one may accept and understand that their biological identity and their gender with which they identify themselves are different before 18 itself. That's okay. But what's even more important is to be able to make a well-informed decision, which requires adequate knowledge and maturity, as it is a lifelong decision with irreversible consequences. One needs to understand their mind and body completely. They need to be well informed about the surgical, hormonal, and psychological therapy options available and understand the risks and long term complications associated with it. Further, important surgical decisions, for example, having to choose between a vaginoplasty or a vulvoplasty. A vaginoplasty where there are more complications and risks, but for people who want vaginal intercourse, or a vulvoplasty with lesser risks, but for people who aren't interested in a insertional intercourse and are okay with orgasming clitorally. They need to be well thought about procedures like vaginal dilation, douching, and decisions to be okay with not being able to conceive in the future or freeze sperm their eggs for later. There is also a scope for regret. Walt here was a little boy who was sexually abused, due to which he developed gender dysphoria. But due to improper psychological assessment, he was misled that surgery is the only option and explains how he greatly regretted it, as maybe counseling would have been enough for him to overcome his dysphoria. And as we are all Indians, it is difficult to acquire this knowledge as children under 18 due to the lack of support from our families, transphobia in the society, insensitive health workers who consider it as a taboo. Families might not support their children well enough mentally and financially. Hence, by the age of 18, they will be able to finance for therapy sessions and won't require anyone else's consent to make their own decisions. My opponent, Insha, had also argued, saying that so do people have to suffer in their bodies till 18? People suffer due to two reasons. One, due to
30
their
seconds to go.
due to their gender dysphoria, and the second and most important reason is because they have to pretend to be someone else because they aren't accepted by their families, judgment, society, constant abuse and bullying. This is where the actual problem lies. We need to create a society where the child's thoughts are not suppressed with judgment, where one expresses themselves and we understand, educate, and normalize them as they are and help them bloom. Healthcare workers need to be sensitive, open, affordable, and accessible. Legal procedures like changing their pronouns must also be simplified and accessible. Mental health therapy to fight anxiety, judgment, loneliness must be made accessible to all. I hope together we reach one day where everybody is already come out of the closet from the very beginning rather
Now
than
we are
having
3
to come.
minutes around. Yeah.
Thank you.
Yeah, thank you, Sonali. You've taken 3 minutes and 20 seconds. Next, we have Amukta contradicting Sonali.
Yes. Okay, I will be starting now.
Okay.
Okay, so Sonali, I thought your speech was actually in a way contradicting itself, because as you mentioned a lot of like physical attributes, surgical, medical attributes, but you also mentioned the fact that there is a lot of mental stress that also goes into questioning your identity. So, as you mentioned, why does gender affirmative therapy as because this is what we're talking about. Why does gender affirmative therapy always have to be about surgery? Why does it? There is also a reversible and irreversible aspect to gender affirmative therapy. The reversible being hormonal therapy. So even though they don't take reversible therapy, there is also a chance of educating themselves. There is also a chance of therapy, talking and sharing about the experiences. For some people, even changing their pronouns or renaming themselves help. So why? So I thought you just contradicted yourself. Thank you.
Thank you, Amakta. You've taken 52 seconds. And now, Sonali, would you like to justify your point?
Yes, thank you, Mukta, for your question. I don't think I contradicted myself because, like you said, decisions like changing pronouns also are all legal. That also needs to be done above the age of 18 because it is a permanent decision. And hormonal therapy also, I don't think should be started for below 18 because instead of going for hormonal therapy, I think we need to create an environment for them where they're able to talk about their feelings and emotions, and we all collectively, the family and the child, is able to decide for themselves what they want to be. Before 18, I think they don't have the maturity to understand the complications of hormonal therapy and surgeries, which are all permanent and irreversible. So above the age of 18 seems to be enough time for them to understand all the procedures they go through, to be mentally aware enough of what they feel and stand by their lifelong permanent decisions.
Thank you, Sonali. You've taken 56 seconds for your justification.
Thank you.
All right. That was a very, very wonderful speech, Sonali, and I can see how much you have grown from the prelims to what you spoke here, and this is something I really appreciate. And now let's go for the judges' comments. Samyukta ma'am, would you like? I would like to open your comments.
Yeah, thank you so much for balancing both the physical, mental, and the sociological aspect in your discussion. That was a nice speech. Yeah, thanks.
Bharat sir, I would like to open for your comments.
Yeah, she told it excellently. But in future, definitely, if really it is gender identity is there, no. Even though before or after is the not issue, but if law permits, after the complete conclusion, law was framed, no. But at the age of the before 18 years, if everything, if the gender identity is confirmed, then that's okay. But if after 18 age, the law permits no, usually that is another aspect. So exactly this Sonali told right thing. And the contradictory also, she told something, there is no possibility of reversal of something else, no? So that's okay, fine.
Thank you, sir.
Thank you, sir. And Sharda ma'am, I'd like to open it for you.
Yeah, Sonali, nice presentation. I really liked the way you brought the topic of providing the friendly environment before coming to a conclusion of what to do. And the way of presentation is very nice. Thank you.
Thank you so much, ma'am. Thank you, sir. Thank you, ma'am.
And in this point, I would like to appreciate the spontaneity which both participants have displayed. So first of all, I'd like to bring something to all the audience notice. There's a way you prepare for something, and there's only so much you can prepare for. And here we have created a situation where their preparation is being contradicted by someone who has equally and oppositely have prepared against them. And they are contradicting you right from your speech, and then you have to justify yourself. So it's not just reading some data and talking about it, it is about your personal opinion and how clearly you express. So and I really I am surprised to see how well everyone are doing, and I congratulate all the participants for the effort until now and for the forthcoming. Saying that, thank you so much, Sonali. We'll be going with the next participant.
Thank you, sir. Thank you.
So yes, next we have Deependra Singh speaking against the motion. That means he'll be speaking no age restriction for gender affirmative therapy. Deependra, do we have you? Yes. Against Deependra, we have a contradicting participant as Ayush Vaibhav.
Hold on, Deependra, please hold on before you start.
Yes.
Satvik, did you receive all the judges' scores?
Yeah, I just received, just now received.
Received? So
Yeah,
can
yeah, done. Yeah, we can proceed.
Yes, all right. So Deependra, Sulekha, would you like to repeat who is his opponent?
Yeah, Ayush Vaibhav. Ayush, are you there?
Yes, ma'am, I'm here.
Yes, okay. So Deependra, once you start, the timer will go off.
Good evening, everyone. Honorable judges and my dear friends. Myself, Dipendra Singh, and today I'll be speaking against the motion on topic, should compulsory age regulation be imposed on gender affirmative therapy? Let's start by defining what is gender dysphoria. It is the feeling of discomfort or distress that might occur in a people whose gender identity differs from their sex assigned at birth or sex-related physical characteristic. Transgender or gender non-conforming people might experience gender dysphonia at some point in their life. Gender dysphonia is a diagnosis listed in a Diagnostic Statistical Manual of Mental Health, a manual published by American Psychiatric Association to diagnose mental health. If a child suffers from gender dysphonia, might refuse to go to school, fear of being harassed or teased, it can also affect their function at school or work. And such students or children
2,
faces
3, 4,
discrimination.
12.
Adolescents with
12,
gender
20.
dysphonia before gender reassignment might be at risk of suicidal ideation, suicide attempts, and suicides. So I would like to raise a question. What about their mental health? If there is no age regulation, then the person might go to the therapy and get help. If it can help people to expose their gender identity and find the gender role that feels comfortable for their easing distress. With every patient, treatment needs to be individualized. Now, I would like to talk about the gender identity. The person's sex assigned at birth, gender identity, the internal sense of being male, female, neither or both. Gender expression and sexual orientation are the separate things. A child's gender identity isn't always indicative of one particular gender expression, and a child's gender expression isn't always indicative of a child's gender identity. Such child or person needs a respectful, a knowledgeable doctor. Talk talk to your children's doctor about your child's gender identity and behavior and ask for help. Along with your children's doctor, a mental health professional, the parents can be of a great help too. Whatever parents choose, the research shows that kids whose families support the concept of them with a gender which they identify have best mental health and also their children to make a rightful decision. When a child feels that their body is different from the gender they feel inside, the chances to express their true identity can
30
have a
seconds to go.
powerful effect on their self-esteem. In a transitioning, the process doesn't always mean getting surgery. It can take several forms. For example, therapy for the mental health, new names, changing pronouns, wearing clothes, and hairstyle. There is no set formula for transition. Some transgender children are happy to express their gender identity without any medical steps, while others want to change their anatomy. There are hormonal therapy which starts at age 16. Ideally, treatment start before the development of secondary sexual characteristics that can terms to go through the puberty as their identified genders. Puberty can especially upsetting for many transgender children, and let's be honest, it's like upsetting for every children going through puberty around age. Okay. We can start the hormone treatment by releasing the estrogen or testosterone. That means the body won't go through the permanent changes that normally happens during the puberty. But effect of medication can be reversible. Your children could decide later to stop taking them and grow through the physical changes by their biological sex. Thank you.
Thank you, Deependra. You've taken 3 minutes and 30 seconds. Next, Ayush, do we have you?
Yes, ma'am, I'm present here.
Yes. Would you like to start?
Yeah, absolutely. Should I start my video as well?
Yes, you can. Yes, yes.
Okay.
Yes, please do start the video.
Yes, sir. Am I visible?
Yes, you are. So again, the moment you start, your timer will go on.
Okay, I'll be starting now. Okay, your whole speech was filled with definitions and all the laws of different American societies and all, but you didn't address the basic opinion. And the problem is that in Indian society, how to tackle the basic problem of consent from your parents. And the second thing which you mentioned was the Indian society going for a therapy, and you can go for a therapy at a very young age. In our Indian society, going for a therapy at a very young age of 14 or 15 is not feasible at all. And upon that, you are just contradicting by your own, whatever you said, your own things, by saying that instead of psychotherapy, you can even take your parents' consent. So what place exactly are you standing on? Either the parents' consent, or you're vouching for the psychotherapy to be a better alternative to this problem. And the final thing which I would like to contradict is changing of anatomy is the final step of this therapy, which will affirm your position as the stand which you're taking. So without that step happening, I don't think it's feasible, and I don't think it's a complete turnaround and a complete uh, belonging of your being. So how would you define that? That's all.
Yeah, thank you,
Okay.
Ayush. You've taken 1 minute, 3 seconds. And Deependra, yeah, you can start.
Okay, as you said that consent and the parents, the therapy, the parents should give the consent for the therapy. If the family agrees what their child is suffering from, they will give consent. And okay, and let's be honest, we're not living in an old age Indian society where the parents are narrow minded or something. Today everyone's mind are broad open, and they literally think for their child's health. And as you said that changing of anatomy, I also said some transgender people are totally okay with their anatomy and be dressed up again, be dressed up as the another gender. So it's their decision what they want to choose. Like they want to choose their gender as it is, or they want to change their anatomy. It's their decision after they go through the therapy, which they feel easy. Thank you.
Thank you, Deependra. You've taken 50 seconds.
Nice.
So
Vishnu?
yes. So I really like the way you have your time second time during the justification part. You timed yourself very well in your answer. And by saying that, I'd like to open for comments from Sharda ma'am.
Yeah. Be loud.
Ma'am? All right, I guess there's some audio problem. So in the meantime, I'll open for Samyukta ma'am.
Deependra, that was really a nice speech. And thanks for bringing about this concept of, so if you relax the age, that does not mean you don't get permission from your parents or somebody to go through this therapy, right? Parents could still be people who consent. The question is, should the child undergo the therapy assuming the parent consents? So thank you so much for bringing up that point overall. And I also liked your rebuttal. Yeah, thank you.
Bharat sir, I'd like to open for your note on this speech.
Yeah, I appreciate both the speakers. First, the Deependra Singh told right thing. But before 18 years, if it permits, and apart from our family and society, some ethical aspects, legal aspects, if it permits, that is fine. And the second aspect, if before onset of the puberty means secondary sexual onset, it's fine, good and fine. But as per the majority opinion, it is required. Okay. And apart from Vaibhav also, he nicely given for the research or the discussion, it was given unsensible part of the discussion. Both are did well, good job. Keep it up.
Thank you, sir.
Thank you, sir. Thank you so much, sir. And now I'll be opening for Sharda ma'am's comment.
Yeah, both did well. And Ayush, your justification is really super. Objection. Your objection for that, and it's perfect.
Yes. Thank you so much, ma'am. And by saying this, we'll be moving towards the next participant.
Yes, so next we have Arfan Nawaz speaking for the motion. He'll be saying that age restriction or a minimum of 18 years is required for gender affirmative therapy. Arfan, do we have you?
Can you hear me?
Yes, yes.
Yes.
Contradicting Arfan, we have Bhavya Teja. Bhavya Teja, are you there?
Ma'am. Yes.
All right.
Yes.
Before we start, Satvik, did you receive all the responses?
No, I still need to receive Bharat's response.
Okay. Once you receive the response, please let us know. We'll start.
Yeah.
I think Bharat's a
Yeah,
good.
I got the response now. I got the response now. I think we can continue.
Okay. Yes, all right. Okay.
Yeah, Arfan, you can start. The timer will go off.
Arfan, you are on mute.
Oh, I'm sorry. Okay. Can you hear me?
Yes, yes, from now, the moment you start your speech, your timer will go on.
Okay, I will start now. Good evening to everyone present here. I am Arfan. We are here to discuss the legal minimum age required to access gender affirmative theory, GAT. And as you all know, the current gender affirming medical practice includes hormonal, surgical therapy, along with individual and family counseling and supportive social transition. But I have to remind everyone that to use the term gender incongruence, GI, instead of gender identity dysphoria as per the ICD-11, any child that complains of gender incongruence or has a non-binary expression should be heard, and their worries ought to be sorted out by gender identity clinics, which has been a long demand from the trans community. People always focus on the surgery. The preoccupation with surgery and transition objectifies trans people that they don't really get to deal with their real life experience of trans people. Surgery is sort of an anti-climax that is done after all the other things. The point isn't that the individuals under 18 are being irrational or being impulsive. It's rather a preventive measure that we understand the incongruence experience is mentally straining and emotionally scarring. But this stance comes from a medical point of view and the level of medicine that humanity is currently at, and that further studies and research is still due. Research paper by Anderson J. and Mafuda S. both cite out similar concerns that treatment for under 18 GI children and adolescents remain completely experimental. And there's a large number of unanswered questions that include the age of start, the reversibility, the adverse effects, the long-term on medical health, quality of life, bone mineral density, osteoporosis, and cognition. The current evidence base does not support for informed-based decision-making and safe practice for children. I wish to put forth a suggestive bill named Gender Identity Affirmation Therapy Bill, the GATE bill, that the minimum age to be set at 18 for gender affirmative surgeries, both invasive and non-invasive, after fertility storage. And although one can opt for hormone replacement techniques after 18 to 24 months of attaining puberty, and one can opt for puberty suppression after 6 to 10 months of puberty onset, although there should be no bar for psychological therapy. All throughout the process of gender affirmation, there should be a continuous consultation and counseling from a certified gender identity psychiatrist or doctor and follow their advice.
30 seconds to go.
The law should direct all educational institutions to have lessons on gender identity and gender expression as deemed fit by their educational board, with consultation from a national committee of transgender and non-binary people equivalent to WPAT. An individual having any complaints of gender incongruence GI should have free counseling before they are officially diagnosed with GI. And if the psychiatrist deems the presence of parents necessary, especially in the case of minors, a court order will be issued to the parents that their presence is needed at the counseling until they consent to further therapy or psychiatrist rules out GI. Thank you.
Thank you, Arfan. You've taken 3 minutes and 13 seconds. Bhavya Teja, do we have you?
Yes, ma'am.
Yeah, would you like to switch on? Yeah. So you can start.
Yeah, Arfan, you mentioned that free counseling should be provided parents and the children. And if the psychiatrist deem necessary, if the parents' consent should be taken for the therapy, then only you should take that into consideration. So you are telling that minor can also receive the gender affirmative therapy if it's hormonal and the parents' consent. If we impose an age regulation of 18 years that is for the motion, doesn't it contradict it?
I think you didn't get the point. I said the 18 bar that I told should be set for surgery, invasive or non-invasive. But hormonal therapies can be taken before, and puberty suppression can be taken before. The idea that there is counseling always involved leads for a better family discussion about this issue, that it has seen a good family counseling has always led to the consent. It's been statistically proven. Even if they are not proving, they continuously have to go through the counseling, because the psychiatrist has not yet deemed it is not GER. If it's not gender incongruence, then maybe the family consent is not required.
So, all right, are you done, Arfan?
Yes, sir.
Yes.
Yeah.
So from next time, I would request, before you object, please wait for us. So we will conclude.
I'm so sorry, sir.
Yes, and we
Yeah,
will
yeah.
give
so
the
sorry.
time of this person. However, I hope, Sulekha, you have noted the both times.
Yes, I have noted both the times. Bhavya Teja, you have still any issues? You have 30 seconds. I've noted it down.
Okay, and how about Arfan?
Okay, I think we're good to go. Yeah, Vishnu, you can take over.
No. How much time did Arfan take?
Okay, Arfan took for his justification 35 seconds.
All right. So yes. So from next
So
time,
sorry.
please, you space it up. So we will interject. We did not. Want to...
That's okay. Vishnu, Bhavya, do you want to make any other comment?
You're on mute, Bhavya.
Yes, one thing.
Yeah, sure. Go ahead.
I mean, gender affirmative therapy includes hormonal and surgical, but you are only opposing the surgical thing, but not the hormonal thing for the below 18 years. So how do you justify being for the motion? I'm finished.
Okay. Can I start?
Yes, you can start.
Okay, so as medically this thing, the hormone replacement surgery has been seen in light that comes after a year of attaining puberty, that there is a huge difference in non-negative side effects that is seen after the puberty onset. So it depends on what the certified doctor suggests for the particular body. So the whole point is that there is a continuous consultation and counseling from a certified gender identity doctor or psychiatrist, and follow their advice regularly, because each human body is different and they're going to react differently.
Okay, so Arfan, you took 1 minute and 10 seconds. Yeah.
Yes. All right. So thank you so much, Arfan, for the participation, and I now open for Bharat sir's note on your speech.
So apart from this, Arfan, if the bill prepared in this manner, for example, level 1, level 2, level 3 of this, the affirmative therapy, for example, the counseling first step and second hormone replacement and third surgery, for example, if the age permission below 16 years, 17 years, or before onset of the secondary sexual character, right thing. But it needs a majority people to make a law. That is the problem. Okay, now both are said well. Thank you.
Yes, sir. Thank you, sir.
Yes. And Samyukta ma'am, I would like to open for your note on this.
Yeah, and so I like that the balance you brought between completely going for or against the motion, but that kind of diluted your consistency of argument, if you think about it, because the gender affirmative therapy includes, like what Bhavya said, it includes both hormone replacement and counseling and the surgery eventually, right? But I like the overall proposal, much better per se, but you understand, but that is not consistent with the thing, the topic as such, right? So yeah. Anyways, that was a very, very good argument. Yes.
Yes, and I'd like to open for Sharda ma'am's note on this speech.
Very good argument. No comments.
Thank you so much. And then now we're going ahead with the next participant. So, Lekya, over to you.
Yes. Next we have Mukta. Mukta will be speaking against the motion where she'll be telling no age restriction for gender affirmative therapy. Against Mukta, we have our contradicting participant as Vignata. Do we have Vignata also?
Yes, ma'am. Yes.
Yes. Mukta, you can start.
Okay. I'm starting now. Okay, so good evening, everyone. I'm Amukta, and I'll be talking against the motion. So starting off, I will be talking about gender identity because this will be the basic of my discussion today. So gender identity is basically a very fluid concept, and it is influenced by different factors, which include social, cultural, physical, biological, and environmental. It is important to understand that gender identity is not a physiological or a pathological sign that manifests at a particular age. It is expressed by different people in different ways, which might just include renaming themselves or changing their pronouns or in the way they express themselves. For some people, though, gender identity is a fixed entity. For some, it's a constant journey of self-exploration and transformation. Moving on to gender affirmative therapy, it is important to understand that gender affirmative therapy is a form of counseling that helps a person come to terms with their identity in a very comfortable manner. And it does not force a person to take a trans identity just because they are gender non-normative. And it also does not force surgical or medical procedures on them when they don't want to. Moving on, I would like to mention that all of my data that I will be mentioning coming forth will be from American Academy of Pediatrics and from journals taken from Journal of Medical Ethics and Krieger journals. So I think we can all agree that any mental scar that is left at a very young age has a huge impact on us, especially for transgender and gender non-normative children who are bullied, abused, harassed, and victimized at a very young age. In one of the studies that was conducted in transgender and gender non-normative young adults who received support from therapists and from their family, they have shown high levels of self-esteem, happiness, self-sense, self-worth, and even overall health when they were followed up upon as early adults. This will also protect them from certain vulnerabilities that other trans children face, which will include depression, a sense of isolation, even homelessness, moving, and as far as self-harm and suicide. I think it is very convenient to disregard a person's identity and self-expression by saying that they're too young to understand themselves. In an approach that has been called outdated by the American Academy of Pediatrics, which was called watchful waiting, where the child's opinion is disregarded and held off till they attain a particular age to consider their opinion to be valid. I think these children require support, acceptance, and communication to understand themselves but better, and it will also give them time to come to a conclusion and an understanding about their own gender identity. And lastly, I would like to emphasize that gender affirmative therapy is a multi-pronged approach, and it is not the same for everyone. There is no end goal except making the child happy. Thank you.
Thank you, Amukta. You've taken 2 minutes and 52 seconds. Vignata, do we have you?
Yeah.
Yeah.
So can I start?
Can you switch on your video?
Oh, yeah, sure. Am I visible?
Yes, you are. Yes, you can.
Yeah. So, hi, Amukta. I have 3 things to question you. The first thing is, I have heard you speaking about gender identity a lot, than including about the age which we actually want to know. And then also you've took reference from the American articles, but now I feel that we need to correlate with our own country first because the situations here are different. And also I feel that you told seeing them as different gender which is not same as their biological gender, children feel very bad about it psychologically. But then I think that the therapy affects them more than the feeling that they are trans now. Okay, so can you answer these?
Okay, I'll answer these questions. Okay, I'll start now. Okay,
Yes,
first off, I focus so much on gender identity because I think it is important to respect the person before you think you have a right to make a decision for them. You have to understand where a trans person or a gender normative person comes from before you think you have the right to say, oh no, you can't take a surgery before, I mean, above age 18. So that is my justification to question one. Question two is, it is the same. I am quoting an American journal because, you know, I need a standard to quote. I can't just make assumptions off the air. And for so many things we take, you know, we make new rules from the standardizations that have been obtained from different countries, first world countries like America. And the last question is, yes, you are assuming this to be like a leading question, which is the same as saying that when you give a, you know, mental assessment questionnaire to a person with suicidal tendencies to a student, it will make them feel more suicidal than they already were before. So that's my answer.
Thank you, Amrita. You've taken 57 seconds.
Wonderful. And I must say this both a pair of Amukta and Vignita in contradicting and justification, this was beautiful to hear. So I'd like to know
Thank you so much.
what our judges would think about this. And by saying that, I open to Bharat sir.
Yeah, the both are presented nicely. But apart from this, Amukta, no, she mentioned about the analytical research approach data. But apart, India is different. See, social diagram, uh, our Indian culture, different factors are going to be influenced. But our society, our parents, and our educational, all aspects, profile supposed to need some time to implement such type of this thing. But this Vignat also mentioned, but because apart from our law and our demographic profile of our country, different from the American society. So both are right. Okay, now good.
Yes. And now I would like to open for Samyukta ma'am's note on this speech.
Yeah, both of them made very good points, especially Amukta. I agree with one big thing, right? It's no longer okay to hide behind India is different, Indian culture, and all of that, right? We are becoming global. We are becoming our children and parents both have this access to information the same way as anybody else has in the world. It is not okay to hide behind Indian culture and Indian, current situation anymore. So, which is why I really liked Amukta's argument. Thank you.
Yes, ma'am. And in this context, I'd like to mention that I believe our participants were talking about, like, when Vignita opposed towards Indian scenario, it is a relevance towards a situation. Maybe the idea could have been more localized, but I also get the point why Amukta have chosen American American standards, because even in cardiology, we still follow AHA classification. And there are many such things. We still follow ICD-11 and these things. So I really like the way these 2 points have come up in the discussion. And by saying this, I'd like to open for Sharada ma'am's note on this.
Yeah, both did really good.
Thank you, ma'am.
Thank you, ma'am.
And Samyukta ma'am, did you wanted to say something?
Yeah, one small thing I wanted to notice: if any of the participants or anybody want to make an argument that we shouldn't follow, let's say, an American kind of study on its thing, has anybody done such study in India? If not, let's follow what we have, right?
Yes, ma'am, definitely.
Yes, can we move on to our next participant?
Go ahead with this. Yes, we can go for the next participant.
Yes, so next we have Chetna speaking for the motion, where she will be saying that a minimum of 18 years is required for gender affirmative therapy. Do we have you, Chetna?
Yes, ma'am.
Yes. Contradicting Chetna, we have Praveen. Praveen, do we have you?
Yes, ma'am.
Okay. Okay, great. Chetna, can you switch on your video? Chetna?
Yes, ma'am. I'm just trying a minute.
Yeah,
I
okay.
told you I had a problem. 1 minute.
Acha, no problem, no issues. Yeah, go ahead,
I'm
Chetna.
Okay. Okay. Hello. Am I audible?
Yes, yes, you can start.
Okay. Good evening. I'm Chetna Jia from the Oxford Medical College. Gender dysphoria represents a condition where a person's gender assigned at birth and the gender with which they identify themselves are incongruent. Individuals with the above can choose to undergo gender affirmative therapy, which is a set of procedures from psychological counseling to surgery so that it will conform more strongly with your self-identified gender. And I am here to justify that the above can be undertaken at 18 years of age. A paper published in the American Academy of Pediatrics suggests that familial support or peer support is necessary and the counseling may be delayed until they are matured completely, that is 18 years, as only 10 to 20% children have gender dysphoria in adults. Pubertal blockers have physically damaging for the teenagers and can lead to unfavorable psychological consequences, and only 10 to 20% of the children gender dysphoria will continue to manifest even in adolescence. So the children treated with puberty blockers lies in their underdeveloped genitalia. Thus, the GAS will be more troublesome, especially in case of penile inversion vaginoplasty. Jennings, assigned male at birth, had gender dysphoria at the age of 6 years, opted for pubertal blockers. Jazz's surgery was more complicated than others because she did not have enough penile skin to create a vagina. Her surgery took double the time of a typical GAS. In case of hormonal therapy, the main indication is they should have adequate mental capacity to give informed consent and accept this partially irreversible treatment. This is strongly proven that it is established by 18 years of age. This helps in understanding the long-term changes and negligible chance of regret as adults. Bell, a former patient, argued she had been too young, that was 16 years, to consent to the medical treatment overseen by the GIDS that began her female to male transition as a teenager. It is highly unlikely that a child aged 13 or under would be competent to give consent to the administration of puberty blockers. It is doubtful that a child aged 14 or 15 could understand and weigh the long-term risks and consequences of the administration of puberty blockers. The High Court judgment noted particular concerns about the use of the puberty blockers, which is said could be probably described as an experimental treatment with limited evidence of efficacy or long-term effects. With unknown etiology and questionable definition, who can decide the 100% certainty what treatment is in the best interest of a particular patient? Main ethical principles are autonomy and informed consent. The individual must have autonomy of thought and intention when making decisions about medical treatment. This is an especially sensitive field in treat of gender dysphoria because sometimes the individual's desires, hopes, and
30 minutes, 30
expectations
seconds to go.
might not correlate with reality. Experts must be very straightforward regarding specific possibilities, risks, and the last step in medical transition, GAG, is irreversible. Thank you.
Thank you. Thank you. You've taken 2 minutes and 50 seconds. Next, we have Praveen. Praveen, do we have you?
1 minute, ma'am. Just 1 second.
Yeah.
Hello.
Yes,
Ma'am, am I
Praveen.
audible, ma'am?
Yes, Praveen.
Yeah,
you
it's a it's a good presentation, but I have some points. She told about the puberty blockers have adverse effects, but as far as research and databases, puberty blockers have minimal side effects, and puberty blockers can use for 4 years, and there won't be much problem with the puberty blockers. And also, second point is she told mental capacity. The child should have mental capacity, and it should be informed consent. As far as American Association of Pediatrics, there is a rule that the child can be of 7 years can take a medical decision. And also, she told guarantee treatment which we can't use. See, for any surgical and medical person, we can't give any guarantee. Even if an expert also, there is a.
Praveen, your audio is stuck. Sulekha, I hope you paused the timer.
Yes, I paused it. Yes.
Praveen? Praveen? Can someone text him on WhatsApp, Sulekha or Sathik?
Yes.
So since we have a small break, I would like to bring something to all of your notice that 2020 has been a very, very different year in all our lives. And as the pandemic closed your physical doors, it did open out a lot new possibilities. Speaking of myself, I don't think I would have been so actively involved in the wholesome spectrum of sexual and reproductive health if it was not for the pandemic. I was working on menstrual hygiene mostly, and I would probably have tried something only focusing towards that. And it's just surprising for everyone to see how pandemic has given us such new opportunities. And we are so glad that all of you are using this opportunity and coming here and working with us for a cause to create conversations on these important topics among the medical fraternity.
Thank you, Vishnu. So Praveen, do we have you back?
I don't think so.
Okay. Can we start Chetna? She can maybe justify herself like till now, whatever he spoke.
So I guess what are the okay? He spoke for about how much time? So
He spoke for like 55 seconds.
Oh, he took 55 seconds.
Yes,
So,
yes.
Judges, what would you say? Shall we go ahead with this, or?
Yeah, let's go ahead with her justification. Yeah, I think 55 seconds is reasonable. Yeah.
Yes. All right.
Can I start, sir?
Yes.
Yes.
Okay. Okay, so his first question was pubertal blockers. There's still discussions going on, and nothing has been proven concretely, like the role of the physiological puberty in developing gender identity, possible physical or psychological effects of early medical interventions. And the second question was the 4 years or something. The same thing, a paper was published in the American Academy of Pediatrics, and the children who opened up to the parents or peers showed typical rates of depression and only slightly elevated rates of anxiety symptoms compared with population averages. So these children did not differ on either measure from the two groups of controls. So I think counseling may be delayed until they're matured, sir, if they don't open up.
Okay. Thank you, Chetna. You've taken 38 seconds. Yeah, Vishnu, you can take over.
All right. So, Bharat sir, I would like to hear your note on this.
Yeah, Chaitanya mentioned exactly, but she told that the completion of the suppression of the onset of the psychological or mental health issues before the crossing of the puberty, that is okay. But the blockings of the gender blockers are there, no, that is also okay, no problem. Both are the L.
Yes, sir. Thank you so much, sir. And now I'd like to open for Samyukta ma'am's note on this particular speech.
Great. So that was very informative. If you think about it, one of the previous participants talked about splitting the gender affirmative surgery, before and after 18, and it is great to talk about if we really did even something like that. For example, gave the child a puberty blocker, would it even work? And I think, like Chetna said, there are still investigations and research going on, but the point is that is being made is still valid. So yeah, thanks for bringing that out. Yeah, and Praveen also made a very good contradictory argument.
Yes. So I'd like to open for Sharada ma'am's note on this speech.
Yeah, great argument, Chetna, and good points.
Thank you.
Thank you, ma'am. I would just like to remind the participants that when you're quoting some research, don't just say there is no research evidence on this, or don't just say there is research evidence on this. If you have the evidence, give the exact reference that shows that you have done the work. You have done the background study. You are confident with the data what you have. And if you do not have any backup, don't emptily quote researchers. It's not like, I can say, for now, I can say there's a research on Big Bang going on, and we will probably find how the universe is made. But there is no lead from the research has started. The Big Bang experiment started when I was like what, 4th grade, and now I've done with my MBBS, and there is still no actual outcome out of it. So don't just give blind statements. Whenever you're going scientifically, use these terms very, very carefully. This is one thing I would like to mention for all the participants. And saying this, we'll be going ahead with the next participant.
Yes, so next we have Bhavya Teja speaking against the motion. Yeah, she will be saying that there's no particular age restriction for gender affirmative therapy. Bhavya Teja, contradicting participant will be Nawaz. Arfan Nawaz, do we have you also?
Yes.
Yes, Bhavya, you can start once you're ready.
Yeah, I'm starting now.
Yes.
Good evening, one and all. I'm Bhavya from Mallareddy Medical College, Hyderabad, and I'm speaking against the motion that there should not be an age regulation for gender affirmative therapy. I would like to start by mentioning some questions. Why do we need age regulation on gender affirmative therapy? Is it the only way to deal with the problems that are occurring? How is it effective universally? As contenders before me mentioned, why we need age regulation to give the child enough time to understand what she or he is going through and to prevent them from rushing into the decisions that they may regret later. What I want to ask is it the only way to deal with this? What about psychological evaluation for consent? What about introducing a compulsory psychological evaluation instead of compulsory age regulation to serve the purpose? Psychological evaluation has been deemed to like capable of psychological evaluation has been used to deem an adult not capable of being able to give consent. Why shouldn't we use for a child? Psychological evaluation of both child and parent should be done to deem them capable for agreeing and disagreeing for the process. As for the universality, do we really think there are more people who rush into transition and regret it later, or more that are struggling to overcome the duality of their lives? If there is an age regulation of 18 years, will the child not see the point of coming out before puberty, and does that not affect child psychologically? And these are all logical aspects, but what about the emotional aspect? I think we are familiar with the face, like somebody woke up on the wrong side of the bed, implying that even that influences our behavior and emotional state. Imagine wake up in a body that you do not belong to every day for 18 years. I can't even begin to understand the amount of pain and the amount of turmoil they have been through and are still going through. What did they do to deserve such a drastic punishment of imprisonment in their own body? If we impose a compulsory age regulation on gender affirmative therapy, we are increasing that sentence and we are taking away the smallest possibility of a child where parents are supportive and having relatively regular childhood and going through the puberty where it's not a nightmare. Even though it may not solve the problem of bullying and acceptance, at least they would feel at home with the body, which is their ultimate fight. Unfortunately, there are not enough surveys or researches regarding transgender community, especially in India. These decisions should be taken by them, not us. Lastly, imposing compulsory age regulation may help some children from committing so-called mistakes, but not imposing age regulation means we are supporting them no matter what they decide. And I conclude by saying we are here to discuss, not decide. And they do not need our help, they need our support. And they're perfectly capable of standing up for themselves. Thank you.
Thank you so much, Bhavya. Those words were wonderful. You've taken 3 minutes and 30 seconds. Next, we have Nawaz. Nawaz, do we have you?
Yeah.
Yes.
There's some problem with my network, so I can't on my video.
No
Is that
problem.
okay?
Yeah, that's okay. You can start.
Okay. Bhavya, wonderful point about raising the importance of trans voices more than cisgender voices. I completely agree on that, on the emotional aspect of your speech. But the thing is the science that humanity is right now would give them that the thing they need, because there are drugs like cyclophenol, GHA regimes, and PT blockers which have substantial harm and even cause of death. See, the child is a growing bottle of chaos. There is so many changes happening in the child, and suddenly in any intervention we could be disturbing this. But I'm not saying that all forms of gender assignment should be stopped. Social transitioning is probably one of the most important phases of gender assignment, that is changing your name, changing your gender. So what do you think about the drugs part? So I'm not talking about the emotional part, I'm talking about only medical aspect of the drugs and surgeries available that would give them, which have less negative side effects.
Yes, Arfan, you've taken 1 minute and 6 seconds. And next, yeah, Bhavya, you can start.
Yeah, I'm starting now.
Yeah.
See, the thing about age restriction, we are talking about age regulation. If the age is mentioned that 18 years, then they have no choice. If the 18 years age is not mentioned, it can be evaluated according to the patient, like personalized to the individual, where we can take hormonal therapy, where we can progress up to surgical therapy. That can be done by the psychological evaluation. See, if a patient, a child comes out to a parent, they directly take them to the doctor, where the doctor should suggest the psychological evaluation as an option, not only to treat them, but also to help their future into respective therapy. They should advise it. I think I have justified. So.
Okay, Bhavya, thank you. You've taken 55 seconds. Over to you, Vishnu.
I personally like your inputs, your for and against the motion inputs very much. Yes, Arfan, you were about to say something?
No, I'm sorry.
Okay. So yes, I personally like the way you have presented the argument by saying that I will be going ahead towards opening for judges' comments, and from Samyukta ma'am, we would like to hear your note on this particular speech.
Yeah. That was one of the most convincing arguments, for the topic that you chose. Though there were not any, real medical or physical aspects that you discussed the most important thing that we should be talking about. So thank you so much for that.
Thank you,
ma'am. And now I'd like to open for Bharat sir's note on this speech.
Yeah, absolutely, I agree with you, Bhavya. As a human being, I support 100%. When I be an expert, medical expert or a doctor, but the maturity of the individual person to take the decision or submission of the consent, socio-economic status of the families, and individual person's health status. So you did good job, and the Nawaz also mentioned nicely. Both are good. Keep it up.
Thank you, sir.
Thank you. Thank you so much, Bhavya, and thank you so much, Nawaz, for both the arguments. And yes, I would like to open for Sharda ma'am's note on this.
Thank you.
Yeah, both of them were very good. Good argument.
Thank you, ma'am. Thank you. And yes, we'll be going ahead with the next participant. So, Lekya, over to you.
Yeah, so next we have Vignata speaking for the motion.
Yes, ma'am.
Yeah, she will be speaking that a minimum of 18 years is required for gender affirmative therapy. And contradicting Vignata, we have Insha Arshad. Do we have you, Insha?
Yes.
Yes, okay. Vignata, once you're ready, you can start.
Yes, ma'am. I'll start it now. Good evening, one and all. Today, I, A. Vignata, would love to debate on the point saying that yes, age regulation must be imposed on gender affirmative therapy. At mere 8 to 9 years, when a kid is playing in the play garden and he doesn't know anything or any drastic effect that he's going to face when he undergoes this gender affirmative therapy, Okay, talking about this gender affirmative therapy, puberty blockers are given to children as a part of the therapy. But then let's take an example. If a girl child is put on these puberty blockers, after a particular point of time, her estrogen hormonal levels are completely depleted. So, what's exactly happening? Is there no real chance of her to get affected by osteoporosis at just 30 years, but not at 50 or 60 when she actually has to get affected? With my little research that I have done, Dr. Radha Krishnan, who studied at Oxford University, found out that children whoever were taking these medications to undergo this therapy were having so many problems like delirium, delusion, anxiety, stress, and behavioral emotional problems with a greater extreme distress. So they tried to augment the therapy after 7 to 10 months. But what happened is there was a tenfold rise increase in cross-sex hormonal level in the same child, which again led to another problem now. Adding to this, with whatever all my colleagues have said, there are many other issues to be discussed, like the emotional instability of the child, the invalid consent of the child, the immaturity of the child, and much more. Also, by giving this gender affirmative therapy, we are promising the child that he'll have a better future after this. But then, with so many sessions, psychotherapy sessions, psychiatric sessions, and medications, does it really impact the education of the child? Yes, it has a lot of impact. Where is all his intellectual capacity going? And still we are sitting here and telling that the child is going to have a better future after this. I really think no. And at that tender age, what is important for the child is acceptance from his parents, the love from his parents and dear ones, and not to show off to the society what he is. Also, I feel that, okay, let us think that the child has undergone the gender affirmative therapy. When he once goes back to his school, there are people around him who will take it like that. No, there is a similar childish mentality around him which will not accept the fact and will bully him for his lifelong. But think again, if an 18-year-old undergoes the same thing, she'll have all the answers to tell the public whatever she feels like. Also, coming to the ethical point of view, I feel that we doctors need to come front and tell the parents about what all their child can actually go through when he
30
undergoes
seconds
this
to go.
treatment. Also, I need to tell or emphasize about friendly psychotherapic sessions and not sessions which are going to be a part of this gender affirmative therapy. Also, I feel that this gender affirmative therapy should become little cost effective, because there are so many other people out there who cannot afford this and are not coming forward to this. So maybe this is how we can actually help them to come forward and express their difficulties. Thank you.
Oh, that was great, Vignata. You took exactly 3 minutes.
Okay, thank you, ma'am.
Next, Insha, do we have you?
Yeah.
Yes, Insha, you can start.
Yeah, Vignata, I would like to ask you to address, like you said about bullying, right? You said, while this child is going through the sessions, he might be bullied, right? How do you explain, like, both the ways he is bullied, right? Either he's going through the session or he's not going through the session. He's bullied in both senses. You very well know of the phrase that mind affects the body. How do you talk about in that his mental status? And do you think, and also one more thing, do you think like the behavioral distress that you were talking about, that is not cured by the counseling? Does schools and parents should not go through counseling just because making the statement that the child might have to go through all these sessions, that is going to put them more into it? Don't you think it'll benefit them more than just keeping quiet about it? Thank you.
Yes, Vignata, you're on mute.
Can I start, ma'am?
Yes, you can start.
Okay, so what do I feel is when a child is having a different having the gender dysphoria, so there is like very less probability of him going and sharing to his friends, because the most that he would share would be with his parents. So I think that whenever he's undergoing the therapy, there might be a probability of his peer group knowing about it. But when he's just having that gender dysphoria, he would just keep it to himself and just take time to talk to his parents and not peers, is what I think. And coming to the other question that you've told me, this behavioral stress is which is an outcome of a medication that they get because of the therapy that he's undergoing. So because already he is just a child, and I don't think he can actually handle so much of it. So that's why in the ethical point, I raised about eco-friendly psychotherapy sessions and not a session which is like a part of this gender affirmative therapy.
Thank you, Vignata. You took 55 seconds. Yeah, over to you, Vishnu.
Yes, thank you so much. So before I open for the judges' comments, there is a small announcement I have to make. So Sharada ma'am had to leave because there is she was called for an emergency C-section. However, she's on the travel now. She's in the car, and she has a couple of minutes before she reaches there. So she wouldn't be able to connect on video. However, she's listening to the audio, and she will be scoring accordingly. Her scores will be recorded as it is. So that wouldn't be affecting the computation. It is just that she wouldn't be present on video or audio. She wouldn't be able to communicate with you people. By saying this, I'll be opening for the comments of Samyukta.
Yeah, thank you, Vignata. That was
Thank you,
a really nice argument. The only thing that I felt was, actually brought out by Insha, that either way, the child is going to be bullied, the child is going to have a problem. The question is, by giving the therapy, by making it, by making a conscious effort to help. The question is, are we going to, make the child's life better or worse? And that again, that is to be seen. We don't know. We need more research and all that. But thank you so much for bringing up
Thank
this
you.
point.
Thank you, ma'am.
And yes, I would like to open for Bharat sir's note on Vignata's speech.
Vignata, conversations, did excellent job.
Thank you,
And
sir.
your way of presentation is it's very convincing.
Okay.
And it is not the issue of the permanent temporary treatment. So, but the child requires something else before the onset of, or some at the initial levels. Some you can avoid some mental and social and economic issues and health related issues. And your opponent also, she given good argument. Congrats, both of you.
Thank you, sir.
Welcome.
Thank you.
Thank you so much, both of you. And now we'll be going ahead with the next participant.
Yes, so next it's our last participant. We have Praveen speaking against the motion. So he will be saying that a no age restriction is required for gender affirmative therapy. Contradicting Praveen, we have Sonali. Sonali,
Yes.
are you there?
Yes, before we start the session, Praveen, so in the previous session when you were speaking, you took 55 seconds. Praveen? Okay. You took 55 seconds. So yes, we assumed like it was, since it was very, very near to the 1 minute timeline, we have considered the points which you spoke, and Chetna was the opponent, right?
Yes, Vishnu.
Chetna have opposed those motions. However, the video is on YouTube. If you want, you can go and check on that later. So by saying this, yes, we can come back to the situation now. And yes, it's over to you, Sulaikya, again.
Yes, you are, Praveen. Yes, you are audible. Sonali, do we have you?
Yes, ma'am.
Yes, okay. Praveen, you can start.
Good evening to everyone present here. Myself, Praveen. I want to talk against the motion. Basically, firstly, let me explain what is gender affirmative therapy. Gender affirmative therapy is a set of procedures starting from psychological counseling to sex reassignment therapy to change the appearance so as to have form a fighting for the self-identity gender. So the role of mental health professionals and psychosocial interveners have a great role and each and every stage of age. So according to universal guidelines, there is no age limit or boundaries for the gender affirmative therapy. Gender affirmative therapy has to be individualized. Some may need both hormonal and surgical, and while others need only one. So according to World Professional Association of Transgender Health Guidelines, there are reversible and irreversible therapies. Reversible consists of hormonal, and irreversible consists of surgical along with psychotherapy. So according to American Association of Pediatrics, it is mentioned that there to be a minor child has the right to take a medical decision at the age of 7, and also for adolescents, according to endocrine society, they can take their own medical decision at the age of 14 years. And in gender affirmative mastectomy is also from the recent databases analysis. They are taking at the age of 14 years, and for the gender affirmative surgeries, they can take at least at the age of 16 years. So there are many children who have precocious puberty, in which because they may live in a different lifestyle or because of a socio-economic and cultural and etc. Ways. So with the use of gonadotrophic releasing analogs like Liberlin and leprolite, so they delay the puberty, and also they reduce secondary sexual character by using these puberty blockers. They cause more potency of life and living, improving a life in both benefits of psychosocial as well as release depression for the students. So I would recommend the government that there should be, because all are the not same. So some may have some
30
really there in
seconds
a
to go.
society there are taboos and stigmas. So by this Transgender Informative and Expressive Act, and also as per minor mature doctrine and minor credit, and also milk principles, so that if the parents are refused, so then the child can take a consent as per the rules, and also
3 minutes
government
up.
should educate them in the society as well in the schools. Also, they should make the learning to students as well as to the parents in the social activities. Thank you.
Thank you, Praveen. We've taken 3 minutes and 14 seconds. Sonali?
Yes, ma'am.
Yes, Sonali. You can start.
Yes. Thank you, Praveen. So you said that these therapy must be individualized for everybody. But do you think a child below 18 years has enough maturity to understand where the long-term risks and potential associated with it to take a decision of maybe a surgery? But that's my question. That is one of my question, because there are so many risks like hepatotoxicity associated with it. So how will the child understand what the long-term risk is going to be, and is he okay with it? For every other surgery, we don't take children under 18 to make their own decisions. So why this? Because this also is going to affect your body in the same way, right? So that is my question. Thank you.
Yeah. So thank you, Sonali. You've taken 47 seconds. You can start, Praveen.
Shall I start now?
Yes, yes.
Yeah, she told that below 18 years they may not know the procedure and the future. But as per as minor mature doctrine, yeah, and there are many precocious puberty children who can know, because they live in a lifestyle because their family situation economically and even socially there will be varied. So it's not the same that below 18 years it's not like immature thing, right? Because we are seeing, because everyone's life is not the same, so there will be maturity also too, because as India has no such rule, but if we have a mature minor doctrine, so definitely it's useful. And by that, and I can't believe that below 18 it's not like a premature. And also for every surgery there will be, and for every intervention also we can't give guarantee of any. So at least it depends upon the patient understanding ability of a medical condition, the doctor will counsel and then will follow.
Thank you, Praveen. You've taken exactly 1 minute. Over to you, Vishnu.
Thank you so much, Praveen. They were very good with the points and everything. So do we have any next participant, or are we done with the speakers?
Yeah, we're done, Vishnu. We're done.
All right. So that was a very, very electrifying debate. We had 10 participants, and each of them have come up with very, very unique concepts, very, very unique ideas. And there have been so many different approaches on the motion. So yes, by saying this, I would like to open for Bharat sir's note on whole session of today. And sir, I would request you to
Sorry, Vishnu. We still have to give comments for what Praveen's thing is before we go to the.
I'm so sorry. I was little carried away on that part. I'm so sorry. So for the comments part, I would like to open for Bharat sir's note on the comment for Praveen's speech.
Yeah. See here, apart from Praveen, he mentioned about general point of view. For example, if they can get the hormonal replacement like reversal or irreversible hormonal replacement before the 18 years. But that law is not permitted because the mental onset of development, the consequences of the are surgery. But apart from the any hormonal replacement, any that is possible by the consent given by the parents. But child does not knows. But I support Vignata. She mentioned that apart from our law of land, we will only undertake the consent after 18, attainment of the majority of the 18 years of the child. But they have definitely the sufferings and problems, everything with them. But to sort out such type things, we should consider in on humanitarian ground, save the life and future of the this gender dysphoria people to accept at least to up to some considerations by the law. Thank you.
Yes, thank you so much, sir. And I would now open for Samyukta ma'am's comments on Praveen's speech.
Yeah, thank you, Praveen, for bringing up one of the most important arguments that we missed throughout: the right of the child to be who they are, right? So that was very, very important. Thanks for bringing it. And I hear people saying that, for the other surgeries, we don't take consent of the child. Let us say that there was a life-threatening situation, right? What is it that you want to do? First, save the life of the child, independent of whether the child wants to be saved or not, because you know what is, right for the child, in the long term, right? So the point is that we need to make sure the child understands what the long-term aspects of whatever they are going to, take up, and then make a informed choice. So the information, giving is our responsibility, not the child's responsibility. Yeah, thanks.
Yes. Thank you so much, ma'am. And yes. By saying this, I would like to, so yes, it took a huge effort from both organizations and a lot of problems which might sound silly while speaking, but while organizing they might be hurdles at every step. So organizing team have done a huge effort, and I would like all the organizing team to come on camera and just say hi for all the participants, and then I'll be opening for the judges' comments on the whole session. We'll be starting with Satvik, our scorer for the previous session and also today. So he has been mostly back camera, and he's a wonderful photographer, and he's a part of my council from Courage. So as every score has been entered, he's checking if they've been registered into the sheet, and he's been entering the contradicting person's scores, and also he's been totaling them for the both sessions. So Satvik, please come on to the camera and say hi for everyone.
Hi everyone, I'm Satvik.
Thank you so much for working with us today, Satvik. We're so glad to have you. And I would like to invite Bhajan from the Council of Courage, our graphic designer who have come up with these wonderful designs, wonderful posters, and who has been literally our technical backbone all through, not just through this event, for many such events which Courage has been doing all this time. He has been a technical backbone and a wonderful graphic designer in the team. And he's also, even currently as we speak, he's monitoring and he's moderating the YouTube situation. Sharda ma'am have raised a hand. Just a second, hold on a second, please, guys, everyone. There was a hand rise in Sharda ma'am. Ma'am, do you want to speak something? If not, please, if that was by mistake, please send a text, ma'am. Okay. Okay. Oh, no problem, ma'am. Yes, and yes, Bhajan. So,
hey guys, I'm Bhajan, and I'm the PRC rep of Courage. And yeah, thank you, Vishnu, for that 5 minutes of praising.
Hey, we can't see him. I can't see him.
Oh, I'm so sorry. Wait. Yeah.
Hello, thank you.
And next, I would like to welcome our person who have come up with so many innovative ideas for this session. And she is the reason why we had this whole counteraction and interjection session. Sulekhya, she is a college representative in Asian Medical Student Association, and from Mamta Medical College. She's a final year student. She has been all through the session. She has been coming up with so many innovative ideas. And initially, I was very skeptical. Speaking very honestly, I was very skeptical because this idea had come up in the last minute. I was worried if we could solve all the problems from making an idea into an executionable format. But she was the one who said we could, and then she was working towards it. And she brought the whole team together, and she made sure we executed this, and she made sure we did it well. So Sulekhya, please come on the camera.
Yes, thank you, Vishnu. Thank you so much for those words. Hi, everyone. Really glad to be part of such an amazing event. This is the first time actually I'm doing something like this, but hope it went well. We organized it well. Thank you so much to all the judges. They've been amazing. And especially to my organizing team from AMSA, including Ramya, who is our state head for Telangana. And also Vishnu, Satvik, Bhajan, you guys were amazing. It was so good to be a part of such an amazing team, and hope to work with many more events coming up.
Thank you so much, Sulekhya. We hope so too. And now, last but not the least, so I want to introduce you all to the person who have started the inception of this idea. So she was the one who called me another day, and she's like, we should have a debate on this. And then we started working towards this and working towards making this a reality. So she has been very persistent towards this. She had a lot of other personal struggles, but still she was making it up every single time. And she did not just bring EMSA together towards this collaboration, but she's also a local officer from Courage. So as a person from both organizations, she has been the link, and a very major link for us to be able to host this session today. Ramya, I would please come on the screen and say hi to all the team today.
Okay. Good evening, everyone. Hi. And firstly, Samyukta ma'am, I'm really glad to have you. I really like every point you raise, and you are a marvelous speaker. I am really big fan. The way you talk, the way you are straightforward, your points. How could you be so amazing, ma'am? Firstly,
Thank you so much. I'm blushing. Can you see that? I'm blushing. Thank you so much.
Okay. And Bharat sir, your medical legal aspect and approach to every speech, everything, you made your point very clear, sir. I really liked the approach you had your approach, sir. And
yeah. Congrats.
Thank you so much for coming, sparing time for us. Unfortunately, Shada ma'am isn't there, but I thank all three judges. Thank you so much. If you three of you weren't here, we wouldn't be able to do this. And thank you so much. It means a lot. These 2 hours from you people is so much. And thanks to the organization team. Thanks, Vishnu. But I just got an idea. Many of us have ideas, but to make it into action, we need somebody. That is Vishnu, who made my ideas, mine and Sulekhya. Sulekhya was the one who wanted to do. She always wanted and to do something for a contribution to this, and brought up this topic. And people should feel free to talk about this. It is not something you should hide or something. You should come up, talk about it. Yes. So ideas came into action through Vishnu's help. So I have to mention that for sure. Everybody has ideas, but who can get into action? Through Vishnu. And Bhajan and Satvik, we are very bad at technical knowledge. If not Satvik and Bhajan, we would be like streaming somewhere behind. So thank you so much, Bhajan and Satvik, like everybody. And my beautiful, beautiful participants, how could you be so good, guys? Each and everybody, you got very good points to debate, good argument, and very great spontaneity. Before I talk too much, okay, I am taking you leave. Thank you so much for giving me this opportunity. Thank you, judges. Thank you, participants. It's really great to meet you all. And
Thank
that's
you
it.
so much, Ramya. And we are so happy to see your excitement on screen. So yes, thank you so much. By saying this with no further delay, I will be opening for judges' comments on the whole session. We'll be starting with Bharat sir.
First of all, I congratulate each and one for excellent this session or this debate, especially this our students they're collected gathered very good updated research based data, very analytical, and both parties they're supporting and participating and against the motion and the promotion. Both are fighting very tough and they're doing justification to their arguments. Both are going on the right track. But for the final thing we are expecting, if it comes before 18 years, if the relaxation before 18 years, that is good. But as a doctor, as a humanitarian ground, as a common man, I can support before the 18 years, apart from the parents and doctors' role and socio-economic level to save the life of the children such victims. And for the any surgical approach, definitely they require the consent because if something permanent surgical approach was done, it is non-reversible. For example, if the person was wants the previous one, so it is very difficult to restore. That is why I appreciate Vishnu, Ramya, and Sulekha, and Bhajan, everyone, Ensha and Praveen, and especially Samyukta ma'am and my colleague Dr. Sharada madam. Everyone did the excellent job, and finally, I am very happy to share and involve in such a scientific session. I am very proud of one and all of you. Keep going and continue the same thing. Definitely, one day we will get the answer to the all sufferings and problems of this gender dysphoria. Thank you, one and all. Thank you.
Thank you, sir. Thank you, sir. I always believe that once we start asking the right questions, universe starts working towards framing the answers for these. And it's such a motivation for us to have you here, have not just a medical but a medical legal expert to bring in so many perspectives, because what a normal person thinks is very much different from our personal opinions, and personal biases are not medically should not be affecting our medical decisions. And this is something a doctor would know very well. And thanks for bringing in these perspectives for our session, sir. We are so glad to have you. And before I open for Samyukta ma'am's talk, there's one thing I want to mention. I want to take a minute to appreciate commitment of a gynecologist on a Sunday evening at 8 o'clock to be attending a C-section. Which is a holiday, and of course I think many of the people are sitting in their houses in luxury, and the moment she got a call, the decision she took, the way she prioritized her profession and her patient is something I professionally admire. And still she did not leave the session. She was still there, and she have completed her responsibility as a judge during her travel. And this is something personally, thank you so much, ma'am. Whenever you I'll be reaching out to you on a phone call and thanking you in person again. But we appreciate this so much, and you are a true inspiration for many doctors, ma'am. Thank you so much. And now I hand over the stage to Samyukta ma'am.
Hey, yeah, thank you so much. And first, by the way, Sharda ma'am did what she did. She kind of demonstrated how important doctors are for in everyday life, right? That their job is so important, that we think that they and they are ready to make these choices because they understand how their job is like very, very important, right? So that was really wonderful. And when Vishnu approached me saying that, hey, we are going to do something like this, what do you think about it? I first thought, like, when see, being a transgender woman, I always knew who I was, right? So when people say, do children have the maturity to go about in making choices or making decisions? One thing you must understand is, almost all transgender people, like I have been, I have had the opportunity to talk to, and in my personal case, right? I always knew who I was, right? It was about taking that step to go ahead, seek help, and talk about it openly with either your friends, relatives, or parents, or whatever. It's about taking that step to go ahead and talk about it, right? Now, so when Vishnu, came up with this thing, hey, we should do this debate, and I suggested let's try this topic because this was, it is very personal for me. So it was wonderful that we decided to go ahead and have this discussion. And I am, though I keep telling people I always knew who I was, I look back at what kind of knowledge I had when I was, 18 or 20. I'm astonished at the level of, understanding and kind of sympathy that you people have for transgender people, and I appreciate that you getting deeper into questions of consent, questions of right, questions of maturity, questions of what the society is ready to take now and not ready, and all that, right? So all of you made a significant contribution to this whole discussion of whether we should actually have an age regulation. One of the things that I take away from all this discussion that we have had so far is, we seem to keep thinking that there are certain things outside of our control that restricts us to be who we can. For example, whether the Indian culture, the society, or the legal issues we have at hand, all of those things, right? But what I really want to request you is, like some people said, an unjust law is no law at all, right? So even if we currently have certain legal restrictions about what a person can or cannot have access to with respect to therapy or hormone replacement therapy or the surgery, right? We keep going, having these discussions, especially within the medical community. So you can help push these laws either way, whether it is making it even more stringent or relaxing, because you are the guys who can help us know more about ourselves, help us be better from what or where we were like a few years ago. So thank you so much for all your contribution, and I'm so glad I had the opportunity to be part of the discussion. Thank you so much, Vishnu, for inviting me. Yeah.
Thank you, ma'am. Thank you so much. And there's a small thing I want to mention, that so whenever as medical students, before we start this journey of the rigorous PMT preparation, and then the first year of med school, which is very hectic, and then second year, third, fourth year, and then for 2 professionals in 4th year, and then you come to the internship. So before we start this journey, it's very rigorous training. We have many nights, sleepless nights. We have many extreme hours of work, extreme pressure, and the kind of environment which we see in medical college is what gives you the mental stability to make decisions which normal person might not. And before we go into such a rigorous training, we there's always an emotional reason. There's something we have seen in our past, which we decided, we wanted to take this journey, even though we were aware about these struggles. And that kind of story comes from people like you, ma'am. So in many ways, you will be producing better doctors for society, and by saying this, and I would also, so first let me give a small note about the results, and then there is a small story I want to say before our judges will be announcing the results, and my team will be coordinating that with you on WhatsApp, ma'am. So please have a look on that. Bharat sir and ma'am, please have a look on the WhatsApp group. And we'll be having, as we mentioned, we'll be having one prize for the motion and one prize for against the motion. And this is something all of you know. And now we have a small surprise for you. We will also be giving a runner-up certificate for the second position person, because the difference between marks is so low. We thought we should appreciate. We cannot just let them go away. So we decided we'll be giving them a runner-up certificate. That will be a recognition for you. So before the whole compilation is done and judges will be announcing the results, I want to say a small story. A story of a woman who was casually gone to a movie, and she came back with a friend of hers. She was just hanging out in the evening, and then she was returning back to her home in a bus. And then some people found this inappropriate and decided to commit a rape on her. This is a story of India's daughter Nirbhaya's incident, which has shaken the country. And among them, there was one small minor boy who was not more than 16 years of age. Yet he have committed such a gruesome atrocity. After which, though Supreme Court did not punish him, did not treat him as an adult while trialing the case, they have brought in a new law after that, saying that if a 16 to 18 year period, if someone commits a crime that seems conscious, they will be put on in a Boston school and they will be put on for a psychological evaluation. And if they are considered to be their intention has been proven conscious, and their intention have been proven clear by the experts, the medical, legal, social experts. It's not just one person. They will be tried as an adult. They will be put in the regular prison, and their punishment scale will be much higher. So, which was not a law before Nirbhaya incident, but this happened after that. And not long ago, homosexuality was studied under perversion in medical textbooks, because that's how the law was. And recently, Supreme Court have amended this act and have decriminalized homosexuality. And today we no longer see it as a perversion. This is today we see it as a sexual orientation, which was again not a law before, but it is now. Going a little into the history, there was something called if a husband dies, we would just push the woman into the fire. And this was again not a law before, and it was changed. So what I believe is that every law is a constraint of the time. It has been framed according to a particular time duration and its relevance to the society, which is why our own constitution has a facility to amend itself. It might not be as frequent as an Apple software, of course, but it has a facility to update itself. And by saying that, we as doctors play such a huge role in this process, because maybe, let us say, in 5 years, 10 years, 15 years, there could be a conversation among the parliamentarians, among the lawmakers, where you all will be placed, we all will be placed, and you could be in an influencing position towards bringing such a change. So hailing towards that journey right from today, let me I would be handing over to Ramya. Ramya, are we announcing the results?
Yes, Samyukta ma'am will be announcing the results for for the motion, and Bharat sir will be announcing the results of top 2 people for against the motion. So Samyukta ma'am, it's all you. Break the anxiety of everybody. Okay, I see Insha and have something to talk. So
Oh,
Vishnu, what do you think?
Yeah, sure. Let's open it up to the participant if they want to make a comment.
Yeah.
I'm happy.
Group picture first, ma'am,
Insha
and
is
then
all.
we'll open for participants. Let's all have a group picture. Everyone, please turn on your cameras. Chetna, can you on it? Do you have the facility? And I think Praveen is there. And who is that one person missing? All right. On a count of 3, everyone. Yes, Amukta is also here. I hope all of you can take screenshots if you are sharing on Instagram and Facebook. Don't forget to tag Simsa, Bleed with Pride, and also EMSA Asian Medical, EMSA India especially. So saying that, on a count of 3, I want a broad smile from all of you. Please position your cameras and be ready. 3, 2, 1. A huge smile, everyone. And I will be taking another picture again on the count. 2, 1. Cheese. All right. Yes, and I guess we'll open the floor for participants before we announce the results. So, Insha, you wanted to say something? You can now.
Yes. Yeah. Hello, everybody. Thank you so much for letting me speak. I actually wanted to make a point here because all the participants here are medical students. While I was doing my study for this, I read a certain personal documents about people, about transgender people talking about themselves, and they said that they didn't even get the bare minimum facilities by the doctors. Because we are going to become one, so I want to request all my friends here on this platform that we should not we should actually give them these facilities. We are talking about like the age should be like changed, right? But the point that they are facing facilities, the problem is that. So I just wanted to request, like, we do our side work properly, and we hope that they don't have any discomfort from our side. And yeah, like when there's a prescription, there is like there is gender, and the patient previously is asked like, what is your birth, like what are you born as, rather than asking like you can ask them what are you assigned as. So that will be a little, like a little here and there would make a difference for them as well. So that's what the point I wanted to make for our friends there. Thank you.
Thank you so much, Insha. The point you bring up is very much included in the sex education curriculum. So we call it gender inclusive language. And of course, obviously, all of us can go ahead and read more on this. And yes, there's a new conversation that is taking on it.
So can I put forward a question?
Yes.
Yes, I just have to do it. I'm sorry, Samyukta ma'am. I just have to do it. I've got to ask you something. If it's okay for you to reply.
Yeah, sure. Go ahead. Yeah.
Yes, ma'am. When you were saying that, when you were giving your speech, there was one very fascinating thing you mentioned. Like, it's the time when you open up and you come out to the world and discuss it with people. You were just about to utter the word partner over there, but you didn't complete it, if I'm right. When is the right time, according to you, if you're discussing this thing with your partner? I definitely think it's about 16 to 18 years over there. What is your thought on this?
So again, it depends on whether we have partners at that age. At least in India, we don't really have partners at that age. So it's a funny thing. But you know what? Um, the first person that I came out as myself was with my close friend at that time, when I was still in school. Right, and she was very supportive of everything that I was doing, and it was to her that I came out. Similarly, when I went to college, something similar happened. Like the close friendships that I formed in college, so those were the people that I came out to. And given that, since you're talking about it, I actually had a partner when I was in college. That I was probably 19.
See,
So yes,
yes.
I did come
So
out
I
to
proved my
him.
point. I proved my point. I won there. Sorry.
Hey, come on, hold on. So who's to say that if I had had the partner, before the age of 18, I wouldn't have gone ahead and talked about it? I mean, there is nothing to say, right? It was just that, it so happened that we
Yeah,
see one
absolutely.
thing.
Absolutely.
One thing is always fascinating is, see, studies suggest that human beings as a group, we are becoming more and more intelligent than we were some time ago, right? In this age of information, right? Like we are bombarded with information. Anybody can go and figure out, what if, for example, when I felt who I was when I was a child, I didn't have Google to go and talk to and ask, is there somebody else with a similar, what is this condition even called? Is there somebody else facing something similar? Right? I couldn't. We didn't have Facebook, so we could have. We didn't have a. We couldn't form a group of people, who were going through the same problem. Right? So 20, 30 years ago, the argument that children are not equipped to make decisions was probably okay. Not anymore, right? We are giving children, all the ammunition to equip themselves, get ready. For example, people say at age 6 they should start coding. Startups
White
are
Hat
there,
Junior.
White Hat Junior, and this and that. People are saying like 6 years, 8 years. People are ready to, invest time in something, some random thing that they could, probably be doing for the rest of their lives, right? And parents are ready to push children to something like this because for the fear of missing out and all that, right? So if parents are ready to take such things so seriously, right, why wouldn't they take something like this, a sensitive issue, like the child talking about their gender or sexuality, and all of that? Why couldn't we take that seriously and assess if what the child is saying is just some random nonsense? Are they really meaning what they're saying? And if you as a parent are not equipped to be able to have that conversation, that is when we have doctors and psychiatrists and everybody to help people make all of this. So we all come together, give the opportunity for everyone to make a conscious decision, and we evaluate, are they making the decision consciously, right? And once that evaluation succeeds, we can say, okay, they can have all the therapy they need. So I really liked that you guys brought up all these things. Wonderful session. Yeah,
That's a fair point, man. Great. Thank you. Thank you so much. It was a pleasure talking to you.
Yes, and as a closing statement towards all the technical discussions we have today, I would propose something like a council or a committee, a regulating committee that doesn't generalize the whole scenario, but could, of course, it's a tough thing. It's not easy in a country with a population as 100 crores. But with the upcoming technology, with the artificial intelligence, with the quantum computing, we are making quantum leaps into the world. We have crossed the moon. We are stepping onto the Mars. We've already sent missions out of the solar system. I'm sure if we as humans start figuring out, we can come up with a solution without compromising the ethical, medical validity of someone before the age of 18 years. We can still figure out a way to give them some relief towards this situation. Maybe a new solution, an innovation can come up. And that could be in a form of a regulating body which could treat individually, that rather than generalizing the situation. Of course, today we are able to, even in a country with a 120 crore population, we are giving licenses only after age of 18. After age of 18 also, we are putting them for checking. So how about in the license process, we are able to put a checking before at the age of 16 years for the learner's license. So how come we cannot do such a system for this particular situation here? So if we work together, I think I'm hopeful we can come up with some idea, and then we can forward this idea towards the governing bodies, towards international organizations. At SIMSA, we have platform and we have access through which we can take these points and we can make sure our voices are heard. And by saying this, I would be handing over to Samyukta ma'am to announce the results, and ma'am will be announcing for the motion, right? Am I right, Sulekhya?
Yes. Before ma'am announce, I want to hear from every participant. Say how excited you are from 1 to 10 in the chat box. We want to see how excited you are.
No.
Because
Just turn on the
I'm the
cameras.
only one who's so excited to listen to the results. I don't see chat box.
We are doing more than a reality show now. We're just counting on the results every single time.
I see Ayush like laughing. He's been so excited since the start of the session. He's like super excited and he wants to, he's waiting for a chance to talk.
I'm like always like this. It's my ground to shine, actually. That's all.
That's really good, right? That's good.
Yes. All right, guys. So we'll be announcing the results now. Come on, if you can turn on your cameras, and yes, you can give me a shout out before we start, and then yes, all of them have muted the mics. Okay. Yes. All right. All right. I guess we can go ahead with that with the results.
Yes. So I'm going to announce the results of people who spoke for the motion. So basically, these are folks that made an argument to have an age regulation for gender affirmative therapy. The runners, so this is an interesting situation because we have two people scoring equal marks, and they are the runners for the evening for the motion. It is Ayush and Vignata.
So, who is the first person on the first position?
And the winner is Chetna for the motion.
Great job. Woo!
Great job. Congratulations to all the winners and to all the
ma'am. Thank you, ma'am.
So, Chetna, as we mentioned, you'll be receiving the trophy. And ma'am, who is the second position?
Yeah, the second position, as I said, is Ayush and Vignata. Yeah. So.
All right. Yes. And yes, now we'll be moving for again as the motion. And Bharat sir, I would request you to announce the results for us.
Yeah, 1 minute.
Yes, sir. No problem.
Yeah, against motion, winners is Praveen, I think. Against is the Amukta. Against Amukta is there.
Thank you, sir. Thank you so much.
And the second position, sir?
1 minute. Second position is Praveen.
Yes.
Congratulations, Praveen.
Thank you, sir.
So I'll be summing up the results once again for all of you. So unexpectedly, we had a tie score, and Ayush and Vignata have landed up in the same position. In the second position as runner-ups, towards for the motion, we have Ayush and Vignata. And winning in the for the motion, we have Chetna in the first place. And towards again as the motion, in second place, we have Praveen. And first place, we have Amukta. Congratulations to all the winners. And again, for all the participants, it has been a wonderful contribution. I'm so glad we have did this, and I'm so glad to have you here. I have seen the scores personally, and it was just a very, very minute slip of marks. It was not much of a score. Please don't get disheartened. You all have done really, really wonderfully, and I'm sure if you show this YouTube video to your friends, I'm sure they would be agreeing with these two. So it is not easy. Something like this is not easy, and we have given a very, very, very tough criteria here to make sure you are on your push to the maximum of your ability. And so under this, and you were given topic only 48 hours before. Under this huge pressure situation, doing such well is something very, very wonderful. By saying this, congratulations to all the winners. As we mentioned, the first positions, you'll be getting trophies delivered to your place. And now I would like to close with vote of thanks by Ramya. Sorry.
Okay.
Ramya, you are the one, right, doing vote of thanks?
Yeah, but
yes.
So firstly, I would like to thank each and every judge. You guys made our day. Thank you for taking out of your busy schedule and weekend time. I understand, but thank you so much for coming here. And participants, you have been very great. Thank you so much. And every one of you, please, I'm telling you, you were brilliant in your own ways, and you're all winners in your own ways. So please don't take these results for like something. Okay, you are winners in your own ways. So shine brighter. Okay, and that's all from my side.
Thank you, everyone. Thank you, sir. Thank you, ma'am. Thank you for joining us today. Thank you for taking so much time. And thank you, each and every one of you, for preparing, for planning, taking out so much of time on your schedules, and that too with exams coming up. I know how stressful it is. So, yes, thank you. Thank you so much, each and everyone. And I guess on this note, we can end the call.
Okay, thank you. Good luck. Thank you.
So thank you so much, sir. I'll reach out to you in person, and thank you again.
Bye-bye. Thank you.
Thank you. Bye.
Thank you, ma'am.
Thank you so much.